From development online to development on the ground. 13 winners from Think 3, the third round of the Think About It blogging competition, embarked on a once-in-a-lifetime reporting trip to Kenya from the 31st of January to the 4th of February 2011. The Think 3 Developing World competition was organized by the European Journalism Center in the lead-up to the United Nations Millennium Development Goals Review Summit in September of 2010. 100 participants, better known as thinkers, blogged for 5 months on various topics covering the Millennium Development Goals, global cooperation, and sustainable development. There were 3 award trips up for grabs in this competition, namely Malaysia in August of 2010, the United States in September of 2010, and Kenya in January to February of 2011. Kenya was the third and final award destination for 13 active and committed bloggers. Coming from different countries and various backgrounds, the thinkers spent 5 days involved in development projects across Nairobi, Kisumu, and Sauri, where they had a chance to see and experience Kenya's development story and its welcoming people. First visit and first impressions. Thinkers were introduced to a different perspective on what it means to live with epilepsy in Kenya, where around 800,000 people live with the disorder and are often excluded from study and work due to misconceptions, superstition, religion, and strong social stigmas. Thinkers visited the Kenyatta National Hospital in Nairobi, where they met Youth on the Move, a young organization that aims to combat misunderstandings and prejudices about epilepsy in their country through education and raising awareness.
We started Youth on the Move in Kenya in 2007. We did it to create awareness on epilepsy because we realized that many people don't understand what it actually is. They confuse it with witchcraft, demon possession and everything. So we started giving education in our training center in Nairobi West, but we realized we couldn't really reach enough people. Many people, they go to the doctor, they get the prescription when they are there. They go home, they take the treatment. After the treatment, when it's finished, they don't realize that they actually need to continue using it, that they need to go back to the doctor for a follow-up prescription. So that's why we felt the need of going to collaborate with hospitals here, like the KNH, the Kenyatta National Hospital. They get many patients per week, but they don't have enough time to explain to the patients that they have to come back once their treatment has finished. So it took a long time to get our collaboration, but we were very fortunate to meet with Dr. Ndega, who's very passionate. He really feels concerned about people with epilepsy, and he has really pushed among the directors of the KNH, the hospital, to get permission to work together with us. So now there are 2 youth, of which one has epilepsy. They really know very, very well what epilepsy is, and they can even give the education on it.
The bloggers learned from Dr. Ndege, a top neurologist at the hospital, and from young people with epilepsy what types of difficulties there are in making others understand that epilepsy is not contagious or demon-driven.
Now, epilepsy, there are many different kinds of epileptic seizures, and the most scary is the generalized tonic-clonic type. And that is quite scary to a lot of people. And people without a scientific background tend to look for other reasons for this seizure. And what happens in this culture is that lots of our people don't have a scientific background. Their levels of education are quite low. So they are going to talk about possession by demons. That's a big thing. They'll talk about being cursed, because our culture is still half traditional, half modern. So traditionally, we didn't have answers to things. We say that if you misbehaved, if you did something wrong, then you would be cursed by the community. And when you are cursed, you can develop anything serious. So a lot of people still believe in curses. Maybe you believe you didn't treat your father or your mother right, you were unkind to somebody, or something didn't go right. And as a result, you are punished by getting epilepsy. So we have talked about demons, we have talked about being cursed. Then others talk about witchcraft. That's also a strong thing. People believe that if somebody doesn't like you, or maybe they're envious of your success, or you have had a disagreement with them about something, anything. People have lots of disagreements about land. Maybe you took their piece of land, or you stole their cows or something. Then they'll go and bewitch you. And that's still a strong component, and people believe that if you get bewitched, then you can develop epilepsy from that. So I think those are the top three.
Following those touching stories, the thinkers dived into the world of innovation with Jessica Kolako, one of the top 40 women in Kenya in 2009, who describes herself as a mobile technology evangelist. Jessica is also the manager of iHub, the innovation hub of Ushahidi, where an open space is provided for the entrepreneurs, hackers, designers, and the investment community to come together in an atmosphere of trust and develop new innovative projects. The thinkers met Eric Hirschman, the founder of iHub and co-founder of Ushahidi, and got an insight into a diverse and groundbreaking territory in Nairobi where innovative ideas are born and new revolutionary technologies emerge.
You know, the challenges for setting up a place like the iHub in Nairobi are really things that can be overcome by the community itself. So what we do is we try and empower the guys who actually work here and guys who work in the city to come together and solve the problems that we have. So if, let's say one is making sure we have a fast enough internet connection, we go out and we talk to the different ISPs and say, hey, here's something that we need, and it's going to help you because you're going to have the guys who are building software working on your network, and you'll get goodwill for it. And so that's how we have one of the fastest connections in Kenya is because we have fiber into the room from one of the local ISPs, Zuku. And then the same thing applies to actual needs in the space itself. So let's say, how do we set up the network? How do we want to make it work? You know, both the Wi-Fi and the Ethernet connections. And we have a team of 5 community guys. So guys who are just volunteers, some of them who work in here every day, some of them who come from outside and work in big corporates elsewhere, who come in, figure it all out, configure it, and that problem is solved for the rest of the community. So really involving the community to solve the community problems.
Leaving Nairobi behind, the thinkers continued on for a 3-day exploration of Western Kenya, with visits to Kisumu and Sauri. Kenya's third largest city, Kisumu, has a high poverty level and a worrying set of health indicators, which is why in 2006, Kisumu was transformed into the first Millennium City, an initiative of the Earth Institute. It aims, together with the local authorities and community, to address development challenges in line with the Millennium Development Goals of reducing poverty. The thinkers visited the Millennium Cities initiative and learned of the challenges the city and its citizens face, in particular delivering social services through education, public health, water, and sanitation. To see these challenges on the ground, the thinkers visited the Kisumu District Hospital, the Manyata settlement where a new water supply made water more accessible for the community, and the recycling plant in Yalenda. The thinkers spent another 2 days in Sauri visiting the first Millennium Village project. Initiated in 2004, the project is part of the bigger initiative of the Earth Institute, which works across 10 countries in Africa towards implementing multi-sectoral interventions in agriculture, health, education, water, and infrastructure.
From my own experience in this project, it has really evolved. It has been able to bring the community members right from being food insecure to food secure. It has also introduced new interventions using simple technologies where their incomes have increased and they are able to stand on their own even beyond the project line. There are various challenges that are yet to be experienced in the coming years, and these are challenges that would range from the weather, because the community is a farming community and sometimes the weather is unpredictable. However, some of the farming communities have been able to come up with irrigation schemes whereby they can still get water for their produce even if the rains fail. Other challenges have been issues of health, whereby the government is supposed to come in and take over the health interventions, but the government processes are slow, and therefore this takes time, requiring that the project continues to support the health interventions, waiting for the registration of the health facilities.
The population of approximately 70,000 people in a cluster of 11 villages, 69% of the population in Sauri lives on less than $1 a day. For 2 days, the thinkers visited the health center in Gongo, the greenhouse in Ruwalo, and the Rabur Primary School. They also got to experience fish farming in Urgana and honey production in Central Gem.
Formerly, I used to engage in farming of maize and beans, which was not actually giving me much per square meter. And sometimes the whole season will just go without me having anything. And that one, I was relying only on rainfall. Sometimes the rains will not come. Then when I started fish now I'm very sure that all the time there will be I will always be having food, and my fish will be available. I'm able to sell them every 4 months or so. So in a year, I sell them twice. And then I'm able to get enough money.
A memory that many thinkers took back home with them was the touching story of little Charles, who had been tested for malaria. The results came back positive just 2 months after his last malaria experience. Nowadays, health workers in Sauri can test malaria during home visits with rapid diagnostic test kits and provide on-the-spot treatment for their patients.
I have seen during this trip a number of things that made me consider development slightly different. In the sense that I am optimistic, but still with skepticism.
I now know better that there are so many aspects into that word, and it's just really hard to know what development is. So yeah, it really changed for me.
This trip, it could be said that changed the meaning of the word development for me. For instance, in this trip I had the opportunity to see on the field development projects, both of the UN and local NGOs, and I started to think and to see the positive as well as the negative aspects that the aid could have.
I don't know if this trip changed the meaning of development for me, but it certainly gave me insights into Africa, since I don't have any experience or very little experience in sub-Saharan Africa. It was extremely interesting to see the reality here in Kenya.
I think this trip showed to me a different face of Africa, one that I never expected. It showed to me like projects on a larger scale, like this multi-approach project, the one that we're in the Millennium Village. I have never been able to liaise with such huge actors, really, apart from the well-known organizations, but like not this type of project. So I was very grateful I really appreciated the opportunity.
Back in Nairobi, the thinkers traveled to Kimende, where they observed the benefits that biogas brings to the local community. It not only spares the women and children tremendous efforts of looking for firewood, but it also creates new jobs for the people employed in construction plants.
The biogas have changed my daily life because there before I've been using a lot of money buying firewood. I have been using about 4,000 per month buying charcoal and firewood, but now that one is cost-free. And now I don't have get tired because I don't use carrying firewood in my back. I don't have chest problem because I have having a lot of smoke, but now my chest is feeling nice.
The trip was co-sponsored by the Dutch Ministry of Education, Science and Culture, and organized in cooperation with the Earth Institute from Columbia University. Do you want to observe development on the ground? Join the latest round of the Think About It blogging competition, Think 5 Water, and enter the chance to win a reporting trip to Portugal from the 18th to the 21st of April 2011.